Fight against COVID-19, the number of deaths in the United States due to the coronavirus has now topped 700,000. The New York Times reports among the most recent 100,000 deaths, fewer than 3,000 were identified as vaccinated so far. But there is hope now of a new treatment. Pharmaceutical giant Merck says it is developing a revolutionary new pill that can fight COVID. Jim Spellman reports.
Hundreds of thousands of lives lost. It's truly staggering, but there are signs of progress in the fight against COVID-19 in the United States. Pharmaceutical giant Merck has developed an antiviral pill to fight COVID-19. Clinical trials show it reduced the risk of hospitalization and death by nearly half. Merck will apply for emergency use authorization in the U.S. as soon as possible. This would be the first antiviral pill for COVID-19.
The news of the efficacy of this particular antiviral is obviously very good news. The company, when they briefed us last night, had mentioned that they will be submitting their data to the FDA imminently. The data are impressive.
The federal government has contracted to buy 1.7 million doses if the new pill is granted authorization. But the White House emphasizes that vaccines are still the most effective tool in the fight against this pandemic. There are some indications that controversial vaccine mandates are working. New York State put a mandate in place for healthcare workers, and the vaccination rate among those workers went from 84% to 87% in just a week. The private sector is seeing similar results. United Airlines put mandates in place, and now 99% of its workforce is vaccinated. The airline has begun firing the holdouts. The White House is also encouraging pregnant women to become vaccinated. They point to data showing the jabs to be safe for mother and child. Meantime, Supreme Court Justice Brett Kavanaugh has tested positive for COVID-19. He was vaccinated back in January. The court says he has no symptoms at this point. The Supreme Court is scheduled to hold hearings on Monday. It's not clear how they will proceed. There are some encouraging signs that the Delta variant-driven wave that we're in now may have peaked. For about 2 weeks now, we've seen new cases decline, and now we're seeing hospitalizations and deaths fall as well. But experts warn that as the U.S. enters the winter months, cases could rise again. Jim Spellman, CGTN, Washington.
And the pandemic is now the deadliest in America's history, surpassing the 1918 flu. Some frontline workers say the death toll is in many cases avoidable. Karina Huber reports.
The 1918 influenza pandemic was far deadlier for Americans on a per capita basis. But experts say many of the COVID-19 deaths could have been prevented because, unlike 1918, we now have vaccines to protect against severe infection.
Given the large amount of adults in America today who are still unvaccinated, and those are the ones who are getting sickest and dying in this latest wave, we did not have to see this.
The majority of recent fatalities have occurred in Texas and Florida, where vaccine hesitancy is relatively high. The two states combined account for roughly a third of all COVID-19 deaths in the United States right now. Intensive care units are seeing greater numbers of younger patients than earlier in the pandemic. The majority of those patients are unvaccinated.
I leave 2 weeks to go to stupid Chicago for a wedding. I was the best man. Had to go. I flew. I get back 3 days later, and I come back with the stupid COVID.
Many U.S. healthcare workers who have been treating COVID-19 patients for more than 18 months say they feel burnt out.
It's just terrible to see younger people this time around. They have children, so it's just been difficult in that aspect, emotionally, physically. It's just been a lot.
Children are also finding themselves in the hospital at greater rates than before, in part because Delta is far more contagious than previous variants.
Anyone could walk in a children's hospital today and see the dramatic impact that COVID and the Delta variant have made on children and adolescents, some with underlying medical conditions, some without. No age group has been spared.
A nurse in a COVID-19 ward at a Florida hospital said she had one wish.
It's depressing, and I wish everybody would get vaccinated so we don't have to keep doing this.
According to the CDC, roughly 25% of those eligible for COVID-19 vaccines have not yet received a shot. Public and private sector businesses have begun implementing vaccine mandates to compel more Americans to get inoculated. Health experts say that's the only way to prevent mass hospitalizations and preventable deaths. Karina Huber, CGTN.